This second review of the autonomic nervous system focuses on the functions of the sympathetic versus parasympathetic nervous systems. As a reminder, you want to recall that when we consider the sympathetic nervous system, fibers are going to arise from the thorax and lumbar regions, or we can say they are thoracolumbar in nature. Sympathetic nervous system has short preganglionic fibers, and that is because these fibers synapse with ganglia that are located close to the spinal cord, as shown here in the sympathetic chain. In the sympathetic nervous system, the postganglionic fibers are long because they extend from these sympathetic ganglia located close to the spinal cord all the way to the target tissue. Parasympathetic nervous system, on the other hand, the fibers arise from the cranial and sacral regions, or we can say they are craniosacral in origin. In terms of preganglionic fibers, the parasympathetic nervous system has long preganglionic fibers, so they extend from the spinal cord all the way to the ganglion, which is located in the target tissue. So for parasympathetic nervous system, preganglionic fibers are long, whereas postganglionic fibers are short. Now let's look at the effect of each system. And again, these systems work in antagonism to each other. So if we find that the sympathetic nervous system enhances function in one area, the parasympathetic nervous system will decrease function in that same area. We'll take a look at what the sympathetic nervous system does, and by memorizing what the sympathetic nervous system does, we simply know that the parasympathetic nervous system will do the opposite. For example, the sympathetic nervous system will cause pupils to dilate, and parasympathetic does the opposite. It causes pupils to constrict. Remember that the parasympathetic nervous system focuses on rest and digestion, so we see that the parasympathetic nervous system will cause increased saliva production, will cause increased motility in the digestive tract. That means increased movement of digestive tract organs like the intestines. It will cause increased secretion of hormones from the pancreas, and it will cause increased secretion of bile from the gallbladder, and that helps us to break down or emulsify fats. The sympathetic nervous system does the opposite. So we see that the sympathetic nervous system inhibits saliva production, slows down movement in the digestive tract, stops or decreases secretion from the pancreas, and also inhibits secretion of bile from the gallbladder. The parasympathetic nervous system, again, rest and digest, causes the heart rate to slow down, and also causes decrease in blood pressure, whereas the sympathetic nervous system causes an increased heart rate and increased blood pressure. When we consider the lungs, we need to know that parasympathetic nervous system causes constriction or bronchoconstriction, whereas the sympathetic nervous system causes bronchodilation. When we consider the urinary bladder, we should know that the sympathetic nervous system causes relaxation of the internal urethral sphincter, and parasympathetic nervous system causes constriction of the internal urethral sphincter. In terms of genitalia, you should know that the sympathetic nervous system, let's look at the parasympathetic nervous system first. So parasympathetic nervous system causes increased blood flow to genitalia in both men and women. So parasympathetic nervous system causes erection in males. However, it is the sympathetic nervous system that causes ejaculation. Let's make a special note here when we look at the adrenal medulla. So the adrenal medulla, again, is a part of a gland that sits on top of each kidney. The inner part of this gland makes the hormones epinephrine and norepinephrine, and in British terminology, these same hormones are called adrenaline and noradrenaline. So when the adrenal medulla is stimulated by the sympathetic nervous system, it causes the secretion of epinephrine and norepinephrine. Notice that there is no corresponding parasympathetic innervation to the adrenal medulla. There are two developmental aspects that we want to talk about in regard to the nervous system, and these are two neural tube defects. And one of the main causes of these neural tube defects is the lack of folate or folic acid. Folate or folic acid is a vitamin that is readily available for many of us in the United States. And we want to be aware that taking it during pregnancy can help to prevent two very severe neural tube defects. So when we consider how the brain and spinal cord develop, we need to know that it develops from a hollow tube known as the neural tube. In order for the brain to develop properly, the top of the neural tube needs to close. In order for the spinal cord to develop properly, the bottom of the neural tube needs to close. Closure of both of these is enhanced by folic acid. If the top of the neural tube does not close, that means that the brain does not develop properly, and this is called anencephaly. In this condition, the infant is born with a major part of its brain that has not been formed. So in many cases, the cerebrum does not form. However, the brain stem may form. And if it does, recall the brain stem is important for involuntary functions like breathing. Depending on how much of the brain has developed, that will depend on how long the individual is able to survive. If the bottom of the neural tube does not close adequately, it can result in a different condition known as spina bifida. Spina bifida is a birth defect where the vertebral column and spinal cord do not form properly, and as a result, elements of the spinal cord as well as the meninges may protrude through gaps in the vertebrae. There are various forms of spina bifida or varying degrees of spina bifida, and in some cases it does not cause any neurological defect. Some people have spina bifida occulta, where we just see a patch of hair on the person's back where the defect has occurred. In some cases, the individual is unable to move their lower limbs as a result of the severity of the condition. That wraps up our review of the autonomic nervous system. Please reach out if you have any questions.